Hello friends. Today we are going to discuss about registration of mental health professional under Mental Health Care Act of 2017. I'm Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic purpose only. And if you want to have a legal opinion, please do contact an advocate. And also, I would like to remind you, this presentation is not a substitute for professional legal opinion. Request you kindly to contact an advocate for legal opinion. Conflict of interest? None. The Mental Health Care Act of 2017 received consent from the Honorable President on 7th April 2017. At the same time, the legislation also mentioned within 9 months after the assent of this legislation, Central Mental Health Authority will be formed under Section 33 and State Mental Authority will be formed under Section 45. That is, within 9 months after the assent of this legislation. And at the same time, the central government notified on 29th 2018, this mental health care came into force. That means now this legislation is in force. Under no circumstances you cannot say the Mental Health Review Board is not formed or State Mental Authority is not formed, cannot be said. This law is now in force. Now, let's discuss about the registration of professionals. There are two authorities we discussed. One is Central Mental Authority and the State Mental Authority. The Central Mental Authority, with regard to registration of professionals, under Section 43D, it clearly says it will maintain only the national registry. This register will be updated from the respective state mental authority, sending them that these are the mental health professionals they have registered under their state. So please do remember, the state mental authority is the one who is going to register all the professionals who are working in the respective states. Who are those mental health professionals who need to register? One is mental health nurse, clinical psychologist, and psychiatric social worker. But however, there are two important categories which have not been considered here. They are psychiatrist and the Ayush doctors, who are also considered as mental health professionals. But however, they are not need to register under the state mental authority. They have their respective registering bodies for the registration. But this is the beauty of this legislation. The mental health professionals need to be registered under state mental health authority. Who are these mental health professionals? So the mental health professionals, as defined under the Mental Health Care Act, it is either a psychiatrist or else a professional registered with the concerned state authority under Section 55. At the same time, it also says a professional who have a PG or a postgraduate degree in Ayurveda or postgraduate degree in psychiatry from homeopathy, Unani, Siddha, they also will be considered as mental health professionals. But however, the subsection 2, the state authority will register only those who are under the mental health nurse, clinical psychologist, and psychiatric social worker nomenclature. These are the people we need to be registered under the state authority. But let's understand, there have been a lot of doubts with regard to psychiatrist. The definition of psychiatrist is very clear. They have clearly said that a medical practitioner possessing a degree, postgraduate degree, or a diploma in psychiatry, awarded by the university, recognized by the UGC under the UGC Act of 1956, or awarded or recognized by the National Board of Examination, that is DNB, included in the first schedule of IMC Act 1956, or recognized by the Medical Council, constituted under the Indian Medical Council Act of 1956. And please do remember, and it includes in relation to any state, any medical officer who have regarded to his knowledge and experience in psychiatry has been declared by the government of the state to be a psychiatrist for the purpose of the act can be considered as a psychiatrist. That means any medical officer, he can be MBBS, he can be Ayurveda doctor, need not have PG, can be considered under this act to be a psychiatrist. They may be added under district mental health program for fulfilling the purpose of this act. And also, please remember, there have been certain doubts have been raised by various state mental authority with regard to diploma in psychiatry. Please remember, there is diploma in psychological medicine which has been awarded by many states or many universities and they have been recognized. But however, in the next amendment, definitely diploma in psychological medicine will be considered. But however, diploma in psychiatry and diploma in psychological medicine both are same, because there is postgraduate degree in psychiatry and also postgraduate degree in psychological medicine. Even NIMANS earlier they used to give degree called as postgraduate degree in psychological medicine. So psychological medicine and psychiatry both are same for the purpose of this legislation. But however, for the purpose of legal, it needs to be amended. Coming to the registration under state mental authority, the three important categories which I mentioned was mental health nurse, clinical psychologist, and psychiatric social worker. Who are these mental health nurses who need to be registered under the state mental authority? A person with a diploma or a degree in general nursing. Means general nursing, either they have a diploma or degree, or diploma or degree in psychiatric nursing recognized by the Nursing Council of India, established under the Nursing Council Act of 1947, and who are registered under the Nursing Council of the state will registered under the state mental authority for the purpose of this legislation. Coming to the psychiatric social worker, a person having a postgraduate degree in social work and also Master of Philosophy, that is MPhil, in psychiatric social work obtained after completion of full-time course of 2 years, which includes supervised clinical training from any university recognized by the UGC, established under the UGC Act of 1956, or such recognized qualification as may be prescribed by the respective authorities. Means, as you know, psychiatric social workers' numbers are very less. They are not more than 2000 at this point of day. That means if they are very less than 2000, that means we may not be able to hire them, or they will not be able to serve under the Mental Health Care Act. The Mental Health Care Act 2017 under Section 18 clearly says it provides mental health care, that is, right to access for mental health care is there. And because of that, we may not be able to have more psychiatric social worker or clinical psychologist. Hence, the drafter of this legislation has intelligently mentioned in the last line, such recognized qualification as may be prescribed has been clearly drafted. Similarly, even for the clinical psychologist under the Mental Health Care Act clearly says having a recognized qualification in clinical psychology from an institution approved and recognized by the Rehabilitation Council of India under Section 3 under the respective act, or having a PG in psychology or clinical psychology or applied psychology and MPhil in clinical psychology or medical or social psychology obtained after completion of full-time course of 2 years, which includes supervised clinical training from an university recognized by the UGC under the UGC Act, approved and recognized by the RCI. So these are the very essential. But however, the drafter of the legislation has given a master stroke to fulfill the human resources. They have clearly mentioned such recognized qualification as may be prescribed. That means if certain states, in the northeastern states or in certain states where they do not have clinical psychologist or psychiatric social worker or even the mental health nurse or psychiatrists are not there, the state government have been given the freedom to notify the qualification as may be prescribed. To conclude, dear friends, the registration of the mental health professional is essential. Basically, mental health nurse, clinical psychologist, and psychiatric social worker under the respective state mental authority. Central mental authority is not going to register them. They are basically going to maintain the registry under the national registry, which the state government will update regularly. And you may ask why clinical psychologists have their own RCI for registration, why they have asked to register under this legislation. I do not have the answer. But however, these are the three professionals who need to register under Mental Health Care Act for providing services under the Mental Health Care Act of 2017. But however, at the same time, the legislation also clearly says penalty for not registering the mental health establishment and working there knowing that it has not been registered. If a mental health professional knows that this mental health establishment is not registered and they are continuing to work, means they will be given a fine of 25,000 rupees. and the state authority is going to adjudicate such a position where the person is working in a mental health establishment where it is not registered. Also, it mandates the mental health professional to register under the Act. To conclude, my dear friends, all mental health establishment needs to be registered, and mental health professionals need to work in the registered mental health establishment, and the professional need to register under the state mental authority for providing services in the state. Thank you very much for giving your valuable time. If you like this video, please do subscribe and share. Stay safe.